We are raising awareness for PTSD, as many people don't know what it is and the possible symptoms and treatments that go along with it. PTSD stands for post-traumatic stress disorder. It is very common in the United States. It's more than 3 million cases diagnosed a year. About 1% of the whole American population is affected by this disease. This disease requires a medical diagnosis, and it can last from months all the way to years. It brings back trauma in, No. I don't like the way that...
Keep going.
I have to keep going?
Keep going. We're going with this.
The disease brings back trauma from scarring events in a person's life. It is most commonly associated with people in the military service, but it's not limited to the military services. This could also occur when met with abuse, either psychological, sexual, or physical, or it could occur after a loved one's death. Hallucinations can also be a side effect of this disease, and they may think they're relapsing back into that traumatic event.
Alright, some symptoms of PTSD can include nightmares, unwanted memories of trauma, avoidance of situations that bring back memories of trauma, heightened reactions, anxiety, or a depressed mood. Some treatment can include different types of trauma-oriented psychotherapy. Some behavioral symptoms can include they can be very agitated, irritable, hostile, hypervigilance, very self-destructive behavior, and social isolation. Some psychological symptoms could be they could have flashbacks, fear, severe anxiety, or mistrust. Some mood symptoms could be they could lose interest and pleasure in activities, and they can feel immense guilt or loneliness. They can also experience insomnia and nightmares. They can also commonly, people suffer from emotional detachment and unwanted thoughts. Some therapies, or you can go to cognitive behavioral therapy and eye movement desensitization and reprocessing. You got that? Some medications are you can take selective serotonin reuptake inhibitor, which is SSRI. Basically, it makes you happy. And specialists, you can go see a clinical psychologist and psychiatrist. PTSD is very serious, and people need to stop turning a blind eye to it and really need to know what it's about. So maybe if they can help the loved one or somebody with it. PTSD is a serious matter that really should be paid more attention to in America. There is a lot of people in the services, and many of them come back with PTSD.